That's why triceps tendinopathy almost always occur around that elbow area rather than this proximal attachment. Hi guys, Mr.Physio here. So in the last video we talked about biceps tendinopathy and today's topic is triceps tendinopathy. As always, let's talk about the muscle's location and function first. And triceps starts from the tip of the elbow and divides into 3 branches. 2 branches actually attached on the upper bone. The remaining branch is attached on the tip of the shoulder blade. So it's attached on the opposite side of the biceps, and normally they work against each other. In the last video I talked about biceps muscle and how it's actually getting tight and shortened because we do a lot of things with our arms bent or sleeping with our arms bent like that, so it can get shortened. So if your arms bent, that means your triceps is always being stretched out. Pretty much is always being stretched out because we bend our arms a lot. If you put a prolonged stretch on the muscle, your muscle gets tight because it always wants to bring your arm into neutral position, so it always wants to contract. That's why it gets tight. What happens if it's tight? So once your muscle gets tight, what happens is, first of all, it affects your shoulder blade movement. So this is back of my left shoulder and the long head attaches here, and if the muscle gets tight, that pulls your shoulder blade down that way. So it gives it a downward rotation force, which is not good for the shoulder movement because we need upward rotation for that. The shoulder blade has to sit upright like this. This is the ideal position. But if your shoulder blade sits in that position, you might want to look at this triceps, the long head of the triceps. And on top of that, if you have round shoulder and your arms rotated inwards like that, so arms rotated inwards that way, that will stretch out this muscle more. The more you put a stretch on the muscle, the tighter the muscle gets. So that will pull the shoulder blade even more out to the side and downwardly rotate it that way. What about the tendon? And it also puts stress on the tendon. So your muscles are attached to the bone through what's called tendon. Your tendon acts as a spring. It always wants to go back to its original length. But as the muscle tension goes up, your muscle gets shortened and tight, and that pulls the tendon away from the bone. So you always have the stretching force on the tendon, and if your tendon is being stretched out, there will be a bit of compression against the bone. And I'm always saying your tendon don't like compression and stretching. In my last video I mentioned that your biceps tendon problems happen more in that long head of the biceps tendon, which is in contact with your upper arm bone. So it's the same thing for triceps tendinopathy. So you don't see triceps tendon problems up here because they attach straight to the bone. But around the elbow area, your tendon is actually in contact with the bone. That's why if you stretch out your muscle like that, there will be compression and stretching happening at the same time, which your tendon doesn't like. Your tendon starts to lose that elastic ability and then breaks down. Especially if you keep using that tendon with the tight muscles against that heavy loading, weightlifting kind of thing. That's why triceps tendinopathy almost always occur around that elbow area rather than this proximal attachment. Because on that proximal attachment, you don't have that compression component. That's why you always see that distal triceps issues. Does it make sense? If it does, let others know so that they know what's going on. So what's the solution? Definitely you don't want to do stretching like this because it has started from the stretching. So if you keep stretching, it will get worse, right? Instead, you want to do massage on that muscle. So you need to loosen up that muscle so that it can actually reduce the tension on the tendon. So let's do some massage and lengthening exercises. To massage the muscle, you need this kind of tennis ball, and just place that in the middle of your upper arm bone and push against the wall. You probably need to hold on to it like that because it slips away. Just push like that and it can go side to side. So you don't want to push into the tendon because it will compress the tendon, which is not really ideal, right? So about 10 centimeters away from the elbow, place the ball there and just push like that, side to side for about 30 seconds. Here, a little bit up and down. So you can do a few spots around there. And then you just press onto the ball and slowly straighten and bend your arm like that. And do more on tighter spots. You can do the same with a ball on the table. You just put some weight on that ball and just move side to side while holding onto the ball. You can do inside of the triceps and a little bit out to the side as well. Find the painful spots and do more on them. Okay, for the eccentric exercises, we're going to use our hands first. So when you straighten your arm, your muscle gets shortened. And when you bend your arm, your muscle gets lengthened. So we want to work that muscle through that lengthening phase only. From this position, you're going to keep pushing your arm, trying to straighten your arm while pulling it towards you using the other hand. So you actually keep resisting through that right hand. That right hand slowly lets the left hand win. Okay? So keep pushing down and pull it towards you. And of course, shoulders back. And you can have your arm like that way. So you're gonna do one arm push-up only during that lowering down phase. So going down in about 3 seconds at least, very slowly. Maybe 5 seconds would be ideal. And come back up, helping with the other hand, and going down and helping with the other hand. I recommend even like coming up with using the other hand. And just one hand, the triceps is being lengthened while controlling that movement. And come back up with the other hand and just going down nice and slowly and come back up. So initially we want to actually lengthen up the muscle first, and then once you get better, you can do this kind of normal wall push-up kind of thing in a slow manner. You can do it with a weight in lying position. Start with your arm straight and slowly lower it down in about 5 seconds. And come back up with the other hand helping and slowly lower it down again. So at the moment my triceps is controlling the weight while the muscle length gets elongated. If you use a cable machine in the gym, you pull the cable with both hands to bring the exercising arm into starting position. And then slowly bend your arm in about 3 to 5 seconds and pull it down again with both hands. If you haven't really done much exercises, these exercises can be quite hard. So you don't want to do too much initially. You just do maybe 2 sets of 5, 2 sets of 7, and slowly build up. And if you can do 3 sets of 15 twice a day, that'll be fantastic. And you need to do that for at least a couple of months to prepare your tendon for the next level. To sum up, your tendon problems normally happen with that compression and stretching component. So you don't want to do stretching on that tendon issue. Instead, you want to do muscle release to get rid of the muscle knots. And then the lengthening exercises to train that muscle's ability to control that stretching force. And this is the best way to rehab your tendon. I hope this video can help with your symptoms, and I will see you next time. 완전 좋아요.
자, 어떠세요? 재밌죠? 재미없어요? 재밌을 낀데.